Hello and welcome to another episode of the Westies and Besties podcast. Thank you for joining us again. My name's Alex, I'm the co-host, and joining me today, I'm delighted to introduce you to a woman who's had a whole career dedicated to red light therapy and the sort of benefits that it can have with your Westie, any dog breed and any species. So without spoiling the intro too much, here is Ruth. And Ruth, thank you very much for joining us. It's been a pleasure. Been down to get you on this episode for a while.
Thank you so much, Alex. It's a delight to be here. Thank you for inviting me.
You're very welcome. So just if for people who maybe new, haven't heard of red light therapy, before we get on to that, could you just tell us a bit of a background about yourself? Because I know you've been in this industry for a few years now.
I have. I mean, I've been involved commercially in the world of electrotherapy for over 30 years now. And the red light therapy as a modality comes under the banner of, well, electrotherapy. Well, not quite electrotherapy, but electrophysical modalities. So it's energy in the form of photons and light. I started in this kind of industry back in the mid-90s, and I've been very fortunate to be introduced to the progression of the modern light-emitting diode technology, which is what I've really specialised in, to be fair. And what is so wonderful about it is that it is very, very safe and it's very affordable. And now, of course, we've got devices here that anybody can use. You don't need to be a trained professional to be able to do it. Unlike most of the electrotherapy modalities, you do seriously need to know what you're doing. I mean, there's simplified TENS machines and muscle stim and that sort of thing. For the progression of the red light therapy industry, it's just been so enlightening and exciting, actually, because the field of research and the ailments or the conditions it's being used for is expanding exponentially.
Wow, excellent. So over the past 30 years, how have you seen the acceptance of this as a proper professional treatment, let's say?
Well, as a light therapy, the red light therapy, predominantly using red and near infrared, that's the most researched type of light therapy that exists. We're now getting into 50 years of research. It's true to say that probably in recent years, the quality of the research has improved. And now, certainly in other parts of the world, it's a commonly used light therapy in hospitals, and it's widely accepted for certainly wound healing and pain relief. I think the American market, to be fair, have a fast track system to get devices into or available for certainly pain relief. In the human world, obviously, there's a lot more research. We're always going to struggle with animal studies because of ethics. And in the early days of using light or photon type light devices, they were predominantly used, I think, in the equestrian market on acupoints. Which helps the light go deeper into the meridian system. So we have to be grateful for the vets that were really starting to utilise photonic devices for acupoint application. But obviously, the LED technology since the mid-90s for sure has got better and better. We've now got medical grade LED technology. And in human medicine, it's got to the point now, Alex, where they're not just looking at the red light therapy from outside the body, but it's being integrated into fiber optics to be utilized internally inside the body.
Wow.
So, the effects are so profound. So yeah, there's all sorts of possibilities, but for me, when I was introduced to the concept of the Fatizo system coming, even before the first devices were brought to market, and it's the same old thing, you just by chance it was an accidental phone call with my South African customer that used to buy electrotherapy stuff from me. And it was just, casual conversation. And they just, the engineer was just saying what they were working on. And it was a light bulb moment for me. After that phone call, I just went on a deep dive on to red light therapy, LEDs, because he was talking about it being used for astronauts in zero gravity conditions.
Wow.
It was helping with reducing muscle atrophy in zero gravity conditions, and also astronauts spending extended periods up in space weren't healing very well, if they cut themselves or got injured. So yeah, it was being used back even in the 90s, with first kind of modern LEDs for all sorts of things, musculoskeletal conditions, wound healing, helping with training and muscle strengthening, that sort of thing. But the actual phenomenon of how it works was discovered finally. The main kind of mechanism, I suppose, it was discovered in 1995 and published by a Russian scientist after 20 years of research. And that key mechanism has never been disputed by any other research. So, yeah,
Wow.
we've now gone beyond that predominant mechanism to identify other effects, biological effects going on in the body when you apply specific doses of red and near infrared light into the body. And it's we're discovering more and more all the time, even now. So yeah, it's very exciting. I learn something new every day.
Awesome. So it was used for the astronauts. So was this the Russian chap? Was this the who did the paper on it? What was he before NASA got hold of this
It
technology?
was a lady, actually.
Oh, sorry. Right.
Yeah, Tina Carew. Um, so she'll be cited on many published papers, and she went on a 20-year program of research after the initial discovery by a Hungarian scientist back in 1967, where he accidentally came across this faster healing phenomenon when he was messing about with his own what he thought was a high power ruby laser, using it on rodents and trying to see if it zapped, cancer cells. But didn't have any effect on cancer. But what it did do is with the incisions of the group that got the ruby laser, low level laser, the incisions healed up a lot faster than the rodents that didn't get the laser. And that was, that's interesting. So that was the first kind of recognition of the possibilities of a faster healing effect. So what Tina did was look at all sorts of wavelengths of light, how deep they went into the body, and obviously discovered some of the biological cascade of what was going on when the light went into the tissue. And she discovered actually it was predominantly the red and near infrared wavelengths that went that bit deeper physically into the body. In the early days of research, they were using professionally what's referred to as low-level laser, because back then we didn't have light-emitting diode technology. So the difference between laser is that the light is pinpoint beam.
Right. Okay.
And so that's when people, if any of your audience are recommended to go and get laser therapy in a practice, they would have to wear goggles, and the dog would probably have to wear goggles, because the pinpoint beam is a risk to eyes. And with the higher class lasers, there's also a potential risk to tissue as well. But yeah. So most of the research started as laser, then the LEDs started getting better, not just used for indicators on electronics. They were actually stronger, and they could be produced with specific wavelengths. So the explosion of red light therapy, say since the mid-90s, with the more modern light emitting diode technology, which spreads the light out, makes it incoherent. So that's why it's so much safer for everyone to use, because there's no risk of eye damage. And it, in some ways, I suppose it's probably a more natural delivery of still concentrated specific wavelengths, but it's a more natural way to deliver, and gentle certainly for sensitive animals, for sure. Because the sunshine is incoherent light. And we now know that the near infrared light from the sunshine is what is reflected off of the green in nature and intensifies, and that's why we feel so great, or one of the reasons why we feel so great when we're out in nature, even in not bright sunshine, but it's, it intensifies that the near infrared regenerative wavelengths that are so good for our health.
Yeah. Wow. Okay. So how does this actually work then? I mean, what sort of common ailments is red light therapy proven to actually? Is it proven?
Yes,
the
yeah,
research
yeah,
that
it's proven. Yeah, we're quite fortunate that with the brand of the Fertizo brand, the engineers who've developed that, and have had the good sense to bring out a low-cost model for home use, they've still persevered and got medical licensing for the models for humans. But the model license for animals is exactly the same. It's built to the same regulations as the medical devices. And that's where we started in the UK. We were only allowed to sell the vet care, which was this one.
Right.
The medical license came later.
Right. Okay.
Sorry, that's the blue one. Yeah, it's that one. Yeah. So that allowed us as a small startup business to concentrate on marketing and getting it introduced into the hands of the animal therapists.
Right.
We're quite fortunate in this country in the fact that certainly if you undertake a veterinary physio qualification, as part of that qualification, you get introduced to all the modalities that help to speed up, assist the body to heal. And that's essentially how it works, is that it's one of the modalities that is very well understood in rehab, because it assists and it facilitates, and it promotes a biological cascade of all the natural healing effects as a result of the phenomenon that the Russian scientists discovered in 1995, in that it fired up a key enzyme in the mitochondria to produce more cellular energy, ATP.
Wow.
So
Okay.
when you really get your head around that, then you have to say, oh, wow, what's possible? Because we've got the same cells all over our body that work the same way when there's damage from any injury, age, disease, surgical trauma. There's that same old signaling, and by firing up the cellular energy, you get a more efficient response within the body to that trauma, or to actually, because our bodies have an innate biological system to heal. But a lot of us, or a lot of the animals, and as we get older, we just need a bit of a helping hand. So my best analogy with trying to get people to understand how it's working is that it's like putting a set of jump leads on the body. So
Yeah.
in the
Okay.
mitochondria is like the powerhouse of our cells. And when there's injury or there's a disease or condition, that mitochondrial energy can easily get very depleted. And just modern life, unfortunately, with even modern lighting systems and not getting out in the sunshine, depletes our mitochondrial function. So yes, I do believe that our modern lives, we are mal-illuminated, and so are certainly our domestic pets. So to be able to deliver the specific wavelengths of light in certainly evidence-based levels of doses, to just concentrate and help that area of the body to overcome discomfort, pain, start helping the body to move beyond the initial trauma of inflammation, then it's a great drug-free way to assist the body's natural biological healing processes.
So it actually, when it's applied to the right area, does it speed up the healing process? Does it like support what's already there and just reactivates that? And
Yeah, certainly when there's pathological situations going on which can impair the healing, and as we get older, we're not so efficient maybe to heal. We do still heal, and you just have to be more patient. But yes, what it does is, it assists the body to handle that initial inflammatory stage, which is a very important part of the process. And that's why I think what's happened in recent times is a realization that the blocking that inflammation with pharmaceutical medication is not actually helping the body long term. It can slow it down, and there has been a recognition of that now. So that's why the physios, for sure, like to integrate some of the energy therapies, because it's assisting that inflammatory stage, which is still important. So there's a lot of signaling that goes on from that stage to then help, say, if there's tissue damage, to help it move on to the next stage where your body is making new cells, blood vessels, and collagen, and it regulates all the process of healing. So there's been a recognition also that it does help to minimize overproduction of scar tissue, which is very important, especially in
Yeah.
performance animals.
Mm-hmm.
And but it's gone beyond using it purely just for when things go wrong. Now there's many of the animal sports where you've got your animal athletes, from your little dogs that compete in agility to your husky racing and equine sports. There's some very good work with using it a lot more proactively rather than reactively, because in the human athletic world, there's been some comprehensive studies, even to the point of getting dose guidelines on elite level athletes on key muscle groups, and it shows that the the effects of the red light therapy applied on the muscle groups helps with performance and certainly the recovery. So
Absolutely, yeah. So
yeah,
I've read articles on that. There's more of an uptake in sports therapists actually using it. I mean, Premier League footballers, for example, and
yeah,
for our American people, family out there as well, is the NFL.
yeah,
It's like because they're playing so often. Once they do get injuries,
yeah.
it's the best way to do it. Where the red light therapy, as you mentioned, it's not intrusive. There are no side effects, are they? Compared to pain relief from
No, no, and
pharmaceutical.
that's the good thing, I think, compared to some of the, all the electrotherapies, certainly for humans, is one of the main contraindications is that people with pacemakers, they can't. I mean, they can't even use TENS machines because it's electrical. We are electrical beings. So with using photonic devices and its photons instead of um, electricity or um, magnetic therapy and that sort of thing, that where there could be a contraindication and a risk of interference with the
Yeah,
rhythms of the heart and that sort of thing. The photonic equipment is fine for everybody.
awesome. I like it how it started off on the humans, then it went to horses, and then it's gone into dogs.
Well, yeah. The thing is, though, our new strap line actually is that it's all creatures great and small, from elephants to voles, because it, you know, all species heal in the same way, or they respond to light in a very similar way. And that's another one of my passions, is just generally the use of light for health and well-being, because we know that um, we're exposing ourselves to bad quality lighting in the workplaces and probably in the homes with noisy lighting that interferes with um, our sleep wake cycle, our circadian rhythms.
Yeah,
And
yeah.
the noisy lighting, actually, often people will be able to pick it up when we're doing videos like this and can see the flicker. Um, so with my being involved with an organisation called the International Light Association, which is a global kind of collective of scientists, academics, researchers, lighting designers, even therapists, healers. We're really trying to get the word out there about the importance of exposing yourself to natural light and using the right sort of light. Certainly winter times, like now, the clocks have gone back, and when we get home it's dark, so we've got to use the right sort of lighting so it doesn't interfere with our melatonin production, which again is one of the recognized effects from red light therapy, is that it helps with melatonin production. And
Wow.
it certainly, well, going back to the animals actually, what we discovered right early on, Alex, was how sensitive they are, how or say receptive they are. So as long as they're not, um, uh, you know, traumatized by a little beep from a machine, sound sensitive, the animals, and this is all creatures tolerate the light very well, but certainly people would have um, experienced that they fall asleep really quickly. You know, they turn themselves round to where they want it, or if they see you using it, they'll come up and say, "Hang on a minute, sorry, I want some as well." Yeah, once they experience the how it feels, um, it can have a very profound relaxing effect, and any anxiety from pain will, you can see in their body language how it really brings them down and relaxes them. I mean, obviously, if it's used in a sports preparation environment, you know, they're excited. It's a little bit different, but certainly in the home, when you're dealing with animals that are in pain, quite a lot of discomfort, it can be very, very calming. It can send them to sleep, and the pain relief effects actually kick in really very quickly with the animals, probably more so than people.
Wow. Well, that's a very good point, actually, because a lot of behavior traits, bad behavior traits of dogs, sometimes it's quite a big percentage now that it's affected by pain.
Yeah,
And this is, this red light therapy can actually change the behavior of the dog and just change its life completely. Like you
yeah,
say, could
yeah.
relax them, put them to sleep. They're not in pain anymore, discomfort. I mean, so the
Absolutely. Yeah, yeah. I mean, you know, when we've worked with some brilliant therapists, hopefully one therapist up in Yorkshire, hopefully you might be able to get her on, but she's trying to educate, and she runs a workshop called Can't Train Away Pain. Um, Sadly, in the working dog world, the observation of potential pain is not really seen. You know, they just think, "Oh, it's a naughty dog." It's not trained. You know, it's. I mean, in some of the training programs, you know, it can make or break the career for a dog in training. You know, a police dog, or security dog, or a guide dog, even. You know, because it hasn't been noticed that that dog's in pain. So how can they possibly concentrate on the
Mhm.
training? They can't. Um, so there's some progress being made for sure. But yeah, in with our work with using Fatizo as a handheld, it's all about consent-based treatment. You must never ever force it on your dog, and they know when they've had enough.
Yeah, they tell us, don't they? Yeah.
Yeah, yeah. So yeah, if you've got a dog that's a, you know, looks at it and thinks, oh, what the hell are you gonna what the hell are you doing with that thing? And you've got to go in so slowly. I mean, some, most of the time they'll lap it up.
Consent with your dog before
Yes,
you start any treatment with the red light therapy. Yeah.
absolutely. Yeah, yeah, because they can't heal, or it causes more anxiety if if they're not comfortable with a device being applied or pad being left on them. So yeah, there's lots of ways to make sure that your dog is comfortable, and desensitization. And for that reason, when we first got the device into the UK, if I can show you, I don't know whether the microphone will pick this up, but when you start the dose, you hear the little beep.
Mm-hmm.
So it's tiny little beep at the start and the end of the dose. But the manufacturers, after the feedback from everyone, you're saying, oh, we need a silent one. So we've got the silent one now. So it doesn't beep at all when you start and stop the dose.
Oh, great. Excellent. Good.
Yeah. So that's the one that is very much utilised with wildlife and exotics and zoos and that sort of thing, because it's predominantly like a hands-off situation. It's not quite like a lovely therapy session with your pets at home.
Right. Fantastic. So you mentioned there the dose. So is there a timer on there for a
Yeah.
particular sort of ailment, or how does that
Yes.
work?
Yeah. I mean, most devices, whether they're handhelds like this or they're wearables, you will get some guideline with what the length of the dose or how long it needs to go on. The thing is, with a handheld like the Fatizo, it's a very, very quick dose level. Um, and it's just with the vet care, it's just 31 seconds. Why it's 31 and not 30, I don't know, but it is 31 seconds. So you can deliver a very effective dose for pain and for any kind of trauma that is expected to get better into that area of tissue. You keep it there for the duration of the dose in that area, and then it switches off when it's done.
Right.
And then you move it to the next area. So is this a good time to bring Phil in?
I think it could be, yes.
So yeah, it's quite a nice little demo dog. He very well behaved. But just to help show people really the best way to use it. So say you've got a dog of any size with spinal problem, IVDD or spondylosis. So you'd start anywhere on the spine, top of the neck even, because they hold a lot of tension in the neck. Start the button, and it delivers a 31-second dose into that area. Occasionally, you will get a dog that does prefer, it to be slightly moved. So you can do a little bit of a massage in that, and try and keep it in that area. But it's basically, the 31-second dose is a specifically timed dose so that it gets a complete dose in that area of tissue. And especially when you're dealing with pain, inflammation in joints, hip dysplasia, elbow dysplasia, any really inflammatory, degenerative, chronic painful condition, then you want to make sure that you apply enough doses. So you move it to the next area, apply another dose, and so on, right down, so that you treat the whole spine basically with repeated doses.
Right. Okay. Right. Very good.
So, but obviously you do have to be mindful about what breed, the size of the animal that you're treating. So, a little Phil here would get one dose, per spot. And likewise, little chihuahuas, Westies, probably, that size of dog. But once you start going up to your Labradors, your bigger dogs, and even bigger, your Huskies, double-coated Huskies, then, depending on what sort of condition you're treating, you might need to do maybe double dose or triple dose in an area. But we do try and encourage people to realise that, say, for instance, you've got a dog with a hip dysplasia problem.
Mm-hmm.
So it's still beneficial to do down the spine, because the thing is, with any limb, the dog will be compensating on all the other limbs,
Right.
and be quite tense.
Okay.
So you use the light therapy to loosen up all that muscle, get the blood flow into their area for sure. And then you certainly, if you're limited for time, start on the concentrated area, but you apply enough doses all around the hip, lumbosacral area, and get them on the side, and you treat up inside.
Right.
In the leg as
Okay.
well, if you can. Yeah. So, with a small cluster, even with a little dog, you can.
Yeah.
I mean, our spaniel, she goes on her back and she lifts her leg up anyways. And she's got a luxating patella issue going on. That's another common problem with lots of breeds of dog, luxating patella. So you use a device like Fatizo to keep all the muscles, as flexible as possible, as well as combining strengthening exercises as well. But yeah,
Brilliant.
you can treat all round the joint, not just take the guidance in the user guide too literally, and because it says one dose, you only do one dose on that spot. You treat, think holistically, think the whole body is affected by an area of pain.
Yeah. No, good point. Good point. So that with the red light therapy plus, what would you also involve a team? So it'll involve like a physio or a hydrotherapist or an osteopath as well for the whole overall treatment.
Yeah.
Yeah.
Yeah, I mean, some people can't necessarily go the whole hog with a whole team in, especially when it's a long-term management of a lifelong condition like IVDD or spondylosis or, the hip dysplasia or whatever.
That's a good point.
And sadly, lots more dogs are getting diagnosed with these conditions younger and younger. And that's another reason to start integrating a drug-free pain relief to help manage that, alongside keeping their core as strong as possible and gentle exercises. The physios and other gait analysis massage therapists, even they are highly experienced with educating the pet parents to, do some wobble cushion work or pole work and that sort of thing. It all helps with the strengthening. So one thing that we can't say for using a device like Fatizo will make them stronger. They've still got to do the physical,
Yeah.
the physiotherapy.
Yeah. Yeah, of course. It's one important part in it. So, say for example that there is an injury, there's some swelling, inflammation. For example, it's treated. You see your vets, maybe whoever else that you've been referred to. But this is something that you can do yourself. You can do it at home. It's safe. There's no side effects attached to it, and you can do it when as many times as you want throughout the day and the week and the coming months to come until they've made a full speed of recovery. Basically,
Yeah,
yeah,
yeah, absolutely. Or just use it as part of the pain management. And especially this time of the year when the weather changes, it's getting colder, they get stiff. don't we all, when we try and get out of bed in the morning? Um, yeah, the oldies, the golden oldies, it is noticeable, but they get out, get themselves up in the morning, and it takes them a little while to get going. So, those are the typical dogs that can really benefit with it being used proactively on a daily basis, or a few zaps round their legs, or certainly concentrate on areas where the pet parents know there's a diagnosed condition, because time is a factor. But yeah, you can use it before you go out for a walk, or if they've gone off like a bit of a Fruit Loop, like they do sometimes, you can use it afterwards, and you think, oh, they're going to be sore later. So as soon as you come home, get them dried off, and if it's best to try and make sure they're dry, because the water in the coats will soak up some of the intensity of the light, because water is a receptor of the light. But yeah, just use it as soon as you think that they've hurt themselves. I mean, one great thing about Fatizo is obviously it's rechargeable. You can carry it out with you.
Wow. Okay.
And that's one great thing with the guys that compete with the sled dogs, canicrossers. They're out in forests in their vans for a whole weekend.
Yeah.
And they're racing the dogs twice. They usually run twice every weekend. So, some of the veteran husky racing dogs, they still love what they're bred to do, but they're starting to get a little bit sore in their pasterns or backs. Got tight spots and old injury spots. So yeah, the sled dog racing community have really embraced the Fatizo very well, because it's all rechargeable.
Awesome.
You don't have to keep it plugged in.
Take it on the go as well. When these husky sled racing, and from a little Westie to Labradors to any dog breed. That's great. Fantastic.
Yeah.
It's,
Yeah. I mean, we love the idea that it's a first aid idea. So we're promoting the Pawly Paws little first aid kits. But yeah, have a Fatizo in your backpack as well when you go off for a walk.
yes, why not? Absolutely. So you could also use those on yourself as well, can't you?
Yeah. A frequently asked question is, well, which model do I use? Do I have to buy more than one? So for personal use, no. You can, because most people, when we first only had the vet care, would use it on themselves. And interestingly, the vet care is the level of dose in that 31 seconds is exactly the same as the sport, which has got a medical license for acute pain associated with conditions that are deemed to get better. So it's all your sports injuries, your overuse injuries, repetitive strain. And funnily enough, this afternoon I was talking to a lady. She phoned, and her little dog, assistance dog or medical detection dog, had been diagnosed with whiplash.
Whoa.
So so the level of dose in the vet care would be totally suitable for those sorts of acute conditions and the acute pain that goes with it. But yeah, you can increase the number of times you apply the dose, especially on your bigger breeds, especially when you're dealing with chronic pain management. And it can be a good solution when maybe your pain meds are not an option at that stage.
Mm-hmm. Yeah.
Or if there's a renal issue going on, so that pain meds aren't really an option from the vets are having difficulty with those situations. So, the vets are obviously getting on board with the total concept of a very safe, simple piece of kit that you can use at home anytime, any place, for lots of different things. And we're very fortunate that the vet or the pet insurers, some of the big players, are now covering the cost of
Oh,
this.
great. Wow. There's been a big shift.
Yeah. Well, it's a bit of a no-brainer, to be honest, because if the pain meds aren't an option, or they're looking, or the vet is saying, well, the meds can only be given for a certain length of time to get an animal out of that initial acute pain situation, but then it's putting in place um, a management program to integrate all various different therapies that hopefully can be covered by insurance if you've got your dog
Hmm.
insured. Um, More and more of them are covering what's considered complementary therapy, but you know that's the reason why we're so blessed actually that the manufacturers have persevered and got medical license, because the vets can be assured that this is built to the same standards and regulations, tested quality control as medical devices.
Great.
And we've got the service backup in the UK. So when things go wrong, even beyond the 2-year warranty, you know, we ship in all the authentic parts, and it gets properly um, repaired, or just a battery change,
Right.
because the rechargeable batteries, they will obviously wear down like any rechargeable battery device. So we keep these going, and yeah, it's a one-off cost for a family that can be used on both four-legged and two-legged members of the family.
Because you'd imagine the amount of money you can save on that in terms of, particularly when it comes to pets, to dogs, in particular, the amount of money that you'd be saving going to the vets for pain relief on a regular
Yeah.
basis every week, let's say, for example, after the initial sort of injury occurred. But that you have got warranty of 2 years. You can take it anywhere you want. You can go sledging with your husky. um,
Yeah.
there's no side effects to it. So when you're taking normal pain relief, something's affected, your kidneys or the livers. That's for humans and for dogs. But that is not
Yeah.
intrusive, and it, it, there's no. I can't see anything wrong with that. To be fair, and in regards to the pain management that it does, and just your dog will behave, but there's so many positives to it, and
Yeah.
it's great that it's been recognised more and more, and it's been used for many sort of different purposes. For, like you said, two-legged to four-legged, so it's
Yeah. Yeah.
awesome. So
Yeah. We get some quite interesting questions from people contacting us, and they'll use a clinical name, so we have to look up the names of all these conditions. So we're getting educated about um, the sort of conditions it can be used for. But essentially, you know, whatever the condition is, your your body's healing response works the same way. And that's the message I try and get through to people. It doesn't matter what it is, there will be a beneficial effect as long as you're applying it regularly, consistently, and correctly. Um, it's not a magic wand. Sometimes you do have to be patient, and please don't stick it in a drawer and forget about it. It's something that you should really have out on the side and use on a daily basis, especially if you've got an older animal, or, um, you're certainly managing something with pain medication. There's no reason why you can't add this in as well to perhaps, to work alongside the medication. That's the beauty. There's no contraindication with any of the meds at all. And I think that's probably why the vets are really coming round to the idea of the concept of people using it at home. They'll certainly be happy to get animals that have gone through surgery, for instance, have an initial course of laser therapy at a vet practice, which has to be delivered by a trained professional. But even the effects of laser will still wear off. It's not like using a session once in a blue moon and expecting the effects to last for weeks on end. It just doesn't work like that. You really have to think about using this form of light as a nutrient, little and often, on a regular basis, and part of the daily sort of wellness routine or supplement routine.
Brilliant. Awesome. So I think what we should do, I think we've discussed, is to do a Q&A. So if our audience out there have any questions at all in regards to what we've covered in today's episode, then feel free to drop me your questions in the email below. It's alex@westiesandbesties.com. I'll pass these over to Ruth. And Ruth, would you like to join us in another episode so you can answer those questions kindly sent over from our audience? Yes?
Yeah. We've just transitioned to a new website, actually, Alex. I forgot to mention. So we've got some work to do to transfer all the blog stories over. But I think certainly the frequently asked questions are there.
Great. Okay.
We're always adding to it because often people come up with a new question that we need to answer. But yeah, I'd love to be able to do a Q&A.
Awesome. Yeah, absolutely. You're more than welcome to come on again, Ruth. That was absolutely fascinating. It's great. Before we go, is there anything else you'd like to say to our audience, and how do they find you?
Well, our business name as the authorised distributor of Vetizo is Daintree Health Products. So it's www.daintree, DANETRE, healthproducts.com. Our social media tags for Facebook, Instagram and YouTube is just Photizo UK. That's PHOTIZO UK. We also have some active little forums on Facebook, one for humans, one for animals. People can join that even if they don't have a Vetizo, to just start learning, what they can perhaps use it for or how other people are using it. So yeah, we're here to support people and educate. I do have a CPD that's aimed at professionals, but it's pitched at a level that anyone can do it, to understand more the science behind it. And it's generic. It's not specific to Vetizo. It's more about understanding the whole modality of red light therapy, which is exploding. So the more information I can get out there, the better.
Awesome. Excellent. And we'll support you as well. We'll get this information out there to as many people as possible. And Ruth, thank you very much for your patience. And thank you for coming on. That was an absolute education masterclass. So again, thank you very much for joining me. And we'll look forward to seeing you on the next one with your answers to our customers and our readers' sort of questions. So brilliant. Ruth, thanks again.
Great. Thanks, Alex.
Hi, we hope you loved today's episode of the Westies and Besties podcast. Don't forget to subscribe, like and comment, and tune in for the next episode. Now, if you'd like to be a guest, please feel free to contact us on the details below, as we would be delighted to share your story and to meet your Westie.